I'm a surgeon to talk about ALS. Yes, I think surgeons do know a little bit. And once I moved to UK, I have been working in emergency department. And there I learned the life support training, both ALS and ATLS. And I have been a medical director and instructor of those courses for the last 10 years. I thought I will put my little thoughts and experience so that I can share with you. Now, when you go to hospital or in UK, maybe even here, you go with a major serious illness or after serious accident, who sees you? Must a junior doctor or a non-specialist doctor, and then you're taken to the ward. It takes hours. By the time you collapse, everyone runs. With a septic shock or a trauma or a severe asthma and a cardiac arrest. Nowadays, the life support system not only treat cardiac arrest, we try to prevent it. Yeah. So I thought I'll put my thought in a few slides. It's a famous picture, came in TV, all the newspapers in UK, and probably you would have seen in YouTube and all over the world. You can see there's a famous footballer from Tottenham Court team, had a sudden cardiac arrest, and they were trained people, basic life support trained people who started the basic life support, and there was a cardiologist with a defibrillator. Most defibrillators are available in public places, and he had been shocked, and he was taken to the hospital. He was in coma for a few days. See how much support he had. All the flowers on the ground, everyone praying for him. And you can see his name on the T-shirts. He is Muamba. And he recovered fully, with full neurological recovery. And he came to the ground to thank thousands of people. And he is one of the ardent supporter and a campaigner for British Heart Foundation, who support the BLS, ALS program. And his advisors train everyone from school, medical students, nurses, paramedics, public. Anybody can use a defibrillator, automatic one, very easy. So that's the story of him. So it's very popular there now. Okay, so the life support programs to prevent unnecessary death, and if there's a cardiac arrest, if you resuscitate properly, they can survive. Same thing with trauma. There are many good examples of success of ALS, attracted public attention. If you go through YouTube, you can see hundreds. There was one famous cardiac arrest in Australian Beach, and so on. Now, everyone knows about this, but just to remind, in the past when we started the ALS course, we only worry about CPR. Nowadays, we consider the first part, that is early recognition and call for help. Those who attended morning lecture, you would have seen and heard about this golden hour. Golden hour is the first hour or first 3 hours where you can maximize your treatment, fluid balance, oxygenation, also basic things. You can prevent shock and ICU. You can reduce the admissions to ICU, and the patient can have a full recovery. That's what we are stressing nowadays, starting with a basic example. Anybody who's trained can do this. So as I mentioned, again, repetition. The schools are taught, public places, they have automated defibrillators, and automated defibrillators are very easy to use, very safe to use. And also, we teach the junior doctors and nurses to seek for help early. Don't wait for the patient to collapse. As Vasumati mentioned, we use the Pew scores or scores to assess a serious ill patient. Now, there's no point in only patient treated in hospital. If somebody has an arrest or serious illness, if public is trained for basic things, we can save a lot. So the paramedics are trained to do all those things. So when an emergency happens in UK, the paramedics go there, start the what you call ABC, they maintain the airway, start the circulations. If necessary, they are even trained to shock. So some of the patients, when they come, they're almost normal. So I think that's the ideal thing. when the patient comes, of course, the resuscitating continues. We have few cases recently, the cardiac arrest brought by the paramedics, resuscitated, sent to the cath lab next door, and they're back home within a few days. It's quite satisfying. That's a team. You always need a team. You can't do it alone. Of course, as mentioned in the morning, we use fast scans to diagnose emergency situations. And of course, PCA is available nowadays in most hospitals for the coronary heart disease. And of course, if you have a severe trauma, immediately they go to the theater. Now, as I told you, I have been directing for a few years. It's a tremendous satisfaction. Not only you treat the patient properly, teach your juniors properly, and it's really satisfying. So all the staff here in Jaffna have talents and keen to update the current medical practice. I'm very pleased to see that it's ongoing. We are thankful to the College of Anesthesiologists to include Jaffna. So that question, why should we lag behind? I will raise it off. And I find that I had few times come to see medical students and teach them and find that it's introduced in their medical curriculum. I'm sure in a few years' time the public will be made aware of this and learn BLS. Now, what are the challenges? As Vasanthi has already mentioned, we had to organize a trained team, whether it's a cardiac arrest team or major trauma team. In both teams, the important person is the anesthetist. And as you probably know, most of the panel members are anesthetists because they are the calming members of the teams, even in theater. Training to work as a team is a must for the successful outcome of this program. Of course, as somebody mentioned, need for equipments, mannequin defibrillators, a place to store them, someone to coordinate the program. Ideally, needs a proper resuscitation training officer as a sole job. It has to be regularly updated because the guidelines change every few years. We have to get our renewal certificate every 4 years. Not only doctors, ambulance, medical students, all should be trained. Regular refresher courses to keep the skill updated. If you miss the skill, after a few months, you are scared to do it. So it's nice to keep them updated. Of course, hope will come soon. Ambulance equipped with defibrillator, monitors should be available. Communication is another issue. I don't think we have bleep system, but at least the mobile phones are very useful to coordinate. Right, we owe a lot to our faculty, all of us. With this mind, I think our president, JMFOA UK, Dr. Madhya Laganandres, had a fundraising event in April 2004 and collected a substantial amount of money to buy mannequins for you all. I am pleased to say that. We have many experienced instructors and directors of these courses, and we are willing to come regularly and help in this program. During the last few years, I was given the opportunity to help in teaching ALS to medical students and junior doctors in Jaffna. I thank JMFOA UK and consultant in Jaffna Hospital and the Dean of Medical Faculty for organizing this. Finally, I think to have a quick treatment, you need an accident emergency department to resuscitate the seriously ill patients quickly. As you know, time is life. You might be surprised to know, as an editor of Jaffna Medical Journal in 1984, I wrote in the journal there was a need for an emergency department. Hopefully that will come soon. We know in spite of the absence of designated emergency department, most doctors and consultants have managed many trauma during the past many years and emergencies very successfully. We thank them for their hard work, saving lives. We need your ideas and suggestions to have a successful training and implementation of life support program. We are behind you. All the members of the alumni, various countries, we are there. Thank you very much.